any dog or cat who has itching, flaking, smell, or licking or ear discharge, they have a defective skin barrier. You have to do something to protect that. Water-based ear cleaners. Why? The yeast overgrowth in the ear is because of moisture. Then we're using water-based ear cleaners to flush the ear out. We just added more moisture. Yes, there's that water-based ear cleaner had lots of other chemicals in there to kill the bacteria, the bad bacteria and the bad yeast. And yes, it solved that problem, but you just added more moisture. So the problem will come back with a vengeance. Itching, constant inflammation in the body. It's not a nice feeling. And then sometimes it causes behavioral issues and you're wondering, why is the dog aggressive, or the mood has changed, or they're snappy. It's because of this root cause that we haven't addressed, and we're compounding the problem by using these cheap products. And it's not our fault, it's what we're being sold.
If you're a dog owner and you go to a pet home or to the groomer, what's the first thing on the label that should just straight away bring up a red flag?
Welcome to the DAFY podcast, the place where you will get expert-led and science-backed advice on dog health and nutrition. No more confusion and no more conflicting opinions. Just clear guidance to help you make informed decisions for your pup. Because when it comes to our dogs, they deserve the very best care. And we, as dog parents, deserve confidence in the choices we make for them. Let's meet an expert.
Poonum, welcome to the DAFY podcast. It's so great to have you on.
Thank you so much for having me, Gaia. It's such a pleasure to be here with you. And thank you for giving me the opportunity.
Yeah, likewise. And honestly, you're very welcome. Like when we initially talked, I was really, really excited because I'm going to say straight away, this is not the type of interviews that I do. Because obviously I normally, as you know, interview people that have kind of a degree in animal nutrition or some, they're vets and things like that. So today's going to be slightly different, but it's just, I was just very, very inspired when I talked to you and what you've done at the back of what you've told me. So I think dog owners would definitely get a lot of value from it. And so I'm really, really excited to have you on today. So Poonum, can you tell us a little bit? So you're a doctor, aren't you? You're a human doctor.
Of public health, so not a medical GP.
Yeah.
Pharmacist by training, and I've done a PhD in public health.
Amazing, amazing. So tell us a little bit about your background first.
Okay, so I graduated as a pharmacist. I worked in quite a few organizations, so NHS, private, non-pharmacy as well, the UN, WHO, UNCCD, etc. Came back because I was in Germany and came back to England, and then I worked in sort of GP practices, developing guidelines, and then finished off my PhD in public health as well. So focus there was looking at sort of research on, it really changes the way you think and view information that's put in front of you in the world. So my focus for the research was drug use in children. But you have to really question, what lens am I looking at this with? Have I got my own biases? And then you learn to put those aside or mention that in the research. I'm looking at it from this particular angle and I'm looking at the research from this particular angle, because there's a lot of bias. And I think this is not talked about a lot in the industries generally. So then, so I looked at research on that. It was all children age 11 to 15 across the whole of England. Very interesting. So I applied social learning theories to a public health problem, which was fascinating. Then we got a dog while we were here, the lockdown. Post-lockdown dogs. Dexter was our first dog. He came home and he was 2.5. We got him from another family. They said he was not getting on with the older dogs, which is why they wanted to sort of sell him. So we brought him home, and the first thing we noticed when I put him in the car was he's smelling a lot. And you only know that because it's a closed environment, right? In the car, it's a 4-hour drive back from Hull all the way down south. And then he started crying. Obviously, he's missing his I don't like to use the word owners, but guardians are supposed to be their guardians. And I just hugged him and I'm like, it's okay, don't worry, it'll be fine. So I hugged him all the way home, but underneath his coat, it was quite matted. So he looked fine from the top. This is, I think, quite common for many dogs. They look fine from the top, but they're really matted underneath. So first thing we did was put him in the bath and he washed him. Smell didn't go away, actually. We didn't know, we just used a normal shampoo. We didn't have any products. And then so we went to I went to Pets at Home, bought everything that I could to help him get rid of the smell, improve his coat, send him to the groomers as well. Groomers said his coat is in such a bad condition, I have to shave him all the way down. So they did that, and I started using perfumes because the smell wouldn't go away. You know the perfumes that they sell in the market? PAW fumes literally. And I was like, this is too strong for me, the baby powder one. this is too strong for my nose. I wonder what's doing to him. And every time I used it, and I noticed that he would sort of withdraw and become the behavior would change a lot. He was not normal. And I said, this is not raw. This is not right. And then I noticed that the products were causing him to itch more, and the smell was coming back. Okay, perfumes in the shampoo would make it disappear for a short time, but it would come back with a vengeance, itching more, shedding more. I'm like, he's not supposed to be shedding that much. And I was like, something's wrong here. And that's what's prompted me to sort of look at the back of the bottles and the ingredients. I'm like, oh my God, these shouldn't be in here. And I only know that because I understand the ingredients and how they should be used. So I said, let me just go do some research. There must be some regulations around this as well. Looked at the regulations, and there are actually no regulations around this. So what's happening is that there are quite a few human cosmetic companies that have ventured into the animal field because it's quite profitable. And the products they're making are designed to appeal to the human buyers. So when we go and shop, we smell, we look at the color, it appeals to us. So we will buy it. And we want our dog to smell like a pumpkin latte during, October, whatever it is, or strawberry, blueberry cheesecake or something. Because we think that's helping them and we're pampering them, right? I did that. Yeah. But so that's one key issue is human cosmetic companies selling for in the pet market. The second thing is human skin is physiologically, fundamentally so different to pet skin.
Yeah.
So pet skin, the way it's structured and the thickness of it is so different. So I could say that it is as thin as baby skin, but it is even thinner in certain areas, like the axilla areas and the underbelly. Yeah. So that's the second issue. And in baby shampoos, for example, we don't use sodium lauryl sulfate because it strips off the lipid barrier. It causes, so think of skin as bricks and mortar. The cells are the bricks and the mortar is the lipid that's holding it together. So SLS, what it does, it's a very effective, extremely harsh cleanser. And it strips off the barrier. So it strips off the lipids and it creates these gaps in the skin. So what's happening is all the water is evaporating, the skin's getting itchy and dry. So, I don't know, if you wash your hands with a certain soap, your hands feel really dry afterwards.
Very dry. Yeah.
We're doing that to the dogs. That's the first thing. So sodium lauryl sulfate, cocamidopropyl betaine, all of these things that shouldn't be there are there. The other thing is it damages and strips of the microbiome. And the microbiome is so critical for maintaining the dog's skin health. So open the gates, let the water evaporate, and now open doors for anything to become an allergen. So people will say, oh, during summer, my dog's allergic to grass or dust or something that's so supposed to be so normal in the environment. Suddenly they become allergic to everything. Why? Because the gates are open. Everything that goes in is the body launches sort of an immune response saying, you're not supposed to be here. I'm going to launch your immune response, inflammatory response to get you out. And the more they get exposed to that, the more chronic the inflammation response becomes and the harder it becomes to treat. So, when we have allergies, our symptoms are more respiratory, sneezing, eye watering. But the histamine production in animals, in pets especially, happens on the skin. So their allergies show up on the skin. So it's very, very different. So this is something that we really need to think about. So microbiome, gates open, we need to close the barrier. The other thing is they lick their skin. Because of the charge of these chemicals and the charge on our skin, they're never really fully washed away. So if you look at the human the cosmetic regulations about when they make shampoos, etc., it's very clear. They have to write, do not ingest. Now, we don't lick our skin, which is fine, right?
Yeah.
Pets do. And this is so overlooked. Pets lick their skin, so they're ingesting these chemicals, minute amounts, on a daily basis.
Yeah.
Whatever you're spraying and applying on them.
For a person that you mentioned skin microbiome, right? Because there is so much talk about the gut microbiome, but not as much about the skin microbiome. That's something I've learned over the last few months. So for someone who doesn't know what skin microbiome is or never heard of it, what is the skin microbiome?
So the microbiome, basically, whether it's skin or gut, is what's the word? It's a collection of good and bad bacteria and fungi. So mainly good. Bad will exist, but the good keeps the bad in check. Bacteria and fungi, I say both. And majority of our genetic makeup is made of bacteria and fungi, because that is what keeps our body sort of functioning on many, many levels, so not just immunity. So the microbiome consists of a flora of bacteria and fungi. The bad bacteria and the bad fungi is what ends up causing the problem. And they tend to proliferate more when the immunity is less, or when we're not feeding the wherever they're, the gut or the oral or the skin properly.
Yeah. Which makes sense, right? Like what happens is you put all of these products and they say like we're killing the good and bad bacteria by putting these products, and then that's
I'll
when you
give you
get
an
the mess.
example. I'll give you 2 examples. I'm just going to write it down. Hexidine and then the immunosuppressive ones. And if I forget, remind me. So, like when dogs are licking their paws or whatever it is, or ears, they're itching, or et cetera, et cetera. So you'll find a lot of these products on the market. So forget the chemicals. They contain things like chlorhexidine or antiseptics. What these antiseptics and regular use of it, and we're now actually seeing a resistance to chlorhexidine, which is very scary. And I think this is also suggested for pets to dip their paws in if they're itching it a lot. So what chlorhexidine does is that it kills, like you said, it obliterates literally everything, the good and the bad. So what happens now is the bad bacteria, which is found in the environment, they grow rapidly. They grow so fast because there's no good bacteria there to keep them in check. And that causes a problem to come with a vengeance. So you'll find lots of pet owners or guardians saying, I use Hibby Scrub, but it solves the problem for a couple of days or so, but it's back again with a vengeance. This is exactly why. Nobody has addressed a skin barrier issue. Nobody has addressed a skin microbiome issue. And it's not allergies. It's basically simple issues that could be solved. But what we're doing is we're just killing everything and not looking at long-term management and not supporting the dog's skin. I think that's critical. Another example is there was a dog on immunosuppressives because of another condition he had under a specialist. The immunosuppressives caused his immune system to get so weak that he picked up aspergillus, which is found normally in forests, when you go out and about. It's found normally. The body would normally manage it. Started causing major lesions, and they couldn't figure out what it was. Send him to a dermatologist who did the biopsy and the cytology, and she was like, whoa, this is aspergillus, and they had to treat him for that. But it was just something so simple. They had to work with the other specialists to reduce immunosuppressives slightly to help the body fight. This is so critical. You have to support the dog's body to fight back, whether it's nutritionally, topically, etc. And then they were able to lower the inflammation, his skin healed, and they kept that balance of the immunosuppressives. So there's so many layers to this.
Yes, there is. I completely agree. And actually, when I link it to nutrition, what I see as well is all of these dogs that, get diagnosed with allergies. It's always allergies. Okay, my dog is itching, or it's food allergies. Okay, it's food allergy. Okay, we can do an elimination trial, but for now, let's just give this dog steroids to help with the allergies. Okay, let's prescribe these steroids, 1 tablet every day, for good. And it's like no one links that to, or actually that could impact that dog's gut microbiome in the long term. So, why is the problem not getting fixed? And no one links allergy. Very rarely I've worked in a dog daycare and boarding business with poodle breeds that are the ones normally, at least here in the UK, that tend to get allergies or sensitivities. No one comes to me as a client that says, oh, the vet diagnosed a, problem with their skin, as if, they might have used like some products that actually could have impacted their skin microbiome. No one says that. But I think the problem comes from the fact that vets, like same as vets don't get trained on as much on the gut microbiome because there is not much research out there. So that, they come out of vet school and no one ever think about, okay, how are we going to restore, except for sometimes giving you some probiotics. You never really go, okay, why don't we check what's going on inside first before we start prescribing the steroids? And, same for you, the skin. Never ever I have heard of a dog coming, where the vet asks, what products do you use on your dog to wash them? Like you come back from a walk, what shampoo do you use on them, right? And could that be the reason why they're itching? Could it be that the, skin microbiome is so messed up that,
because the lipid layer has...
Food allergies and sensitivities are really rare. They are really rare. They don't happen all the time. And so all the vets is like, just give them this one protein diet for 8 weeks.
Okay.
And then the problem doesn't get solved. And then, okay, let's do something else. Okay, nothing works. So let's put this dog on steroid for the rest of their life, because that's the only thing that we can do so that dog doesn't kill themselves, scratching and, and yeah. So, yeah.
So the thing with steroids is, so usually atopic dermatitis, let's talk about that.
Mm-hmm. Yes, please.
So that's actually a clinical diagnosis. And to do that, the vets have to do a lot of sort of testing. One of them is, so first of all, they should do a cytology. on the skin to see what's the cause of this itching and the scratching and for it to go raw. Cytology will tell you whether it's mites. So sometimes it could be mites, it could be ectoparasites. It could be something as simple as defective skin barriers. So approximately 50% of white-haired breeds or light coat breeds are genetically predisposed to atopic dermatitis. Could be a breed issue. It could be a case of the mother's diet when she was pregnant and feeding that affects the baby's, the puppy's outcomes. So, for example, or even cats, same thing. It could be multiple factors. It could be food allergies. It could be environmental allergies. It could be endocrinopathy. So, for example, maybe it's an older dog suddenly develops sort of certain pattern of itching or hair loss in certain areas. It could be thyroid. So, this is what I'm saying, thyroid issues. It could be something like cancers. It could be autoimmune disease. That's why initial sort of cytology, if that doesn't reveal, go for histopathology. See what this is telling you, and then really get under the skin when you're doing the scraping to see what's living there. Usually what they find is in majority of the cases there's superficial bacterial and fungal infection. Manage that, replace a skin barrier, things calm down. When that, and also with food allergies, if you want to know if food allergies is causing the atopic dermatitis, from that entire list I've just mentioned, then you have to do an elimination diet. Then you've got those 2 different proteins. So there's a step-by-step approach to everything. Now, steroids you mentioned are very critical, like you said, to stop if it's really red and raw, to reduce the inflammation, but that's just short-term management. We have to think about long-term management. Why? Steroids cause thinning of the skin. You're compounding the problem. Already thin, skin's already thin, it's already compromised. You're just putting a plaster of it. So it's not a long-term fix. Actually, then Cushing's disease, diabetes, it just adds more issues and all of that other issues. I don't even want to go into that. So, there's all these other issues that we have to think about. Yes, immunosuppressant, do some allergy testing, skin. So allergy testing. There's 2 types of allergy testing, the skin and then the serum. The blood test, neither the blood test or the skin test is going to tell you whether it's a food allergy. They don't. The only way to tell is, like you said, elimination diet. So I think it's really understanding what could be causing it and sort of eliminating it one by one. And it's a long process, but you have to be thorough if you want to manage it long term. And always, any dog with atopic dermatitis, any dog or any cat for that matter, with itchy or flaky, you see the flakes on their skin or matting or any of that sort of smell, please know they have a defective skin barrier. And I'll repeat that. Any dog or cat who has itching, flaking, or paw licking or ear discharge, they're all connected. They have a defective skin barrier. You have to do something to protect that. And it's happening more and more. So after dental conditions, this is the second most prevalent. So this is according to the Royal Veterinary College, second most prevalent conditions that pet owners present with at a veterinary practice. And it's the hardest to manage, the most expensive to manage. And the solution could be as simple as keeping that skin barrier intact. Give the skin the right food, the right materials to repair and keep itself clean. The skin is one of the largest organs. It cleans itself, maintains itself. So give it the tools and it will do its job properly, helps keep that inflammation down. And the other critical thing I wanted to point out was atopic dermatitis was formerly known, the mechanism around it was allergy. It's allergy mediated. Allergies are the cause of atopic dermatitis. As of 2023, which is quite recent, the guidelines said that atopic dermatitis is not just allergy related. The mechanism behind it is not just allergy. It is actually multimodal, and skin barrier defects are a major cause. And this is the American guidelines, American Animal Hospital Association guidelines. And I think we're still to catch up with that.
Yeah.
We haven't caught up with it. And I think that's a major issue. So whenever any dog is prescribed immunosuppressants or steroids, etc., they should really be having topical barrier therapy just to maintain it. And I think
And how do you do that? Like as an owner, I go to the vet, I get prescribed steroids. I don't know about that because they don't tell me that. How do I know how to do that if I'm a dog owner that is going through this with a dog?
How do you know to ask for topicals?
Yes. So is that something that you get from the vet, or is that something that you need to be referred to?
Yes. So historically, what I've seen in the market previously are these brands called Duoxo and Dermocent, which are the Verbac ones. They are just small pipettes that you put at the back or the neck. I don't see how that's going to affect, because it's a whole body. You have to apply to the entire body. All the skin's affected, not just the back. So it's, it may help temporarily, and they come in like 2 ml pipettes. Some vets may suggest it, some vets, I don't know. It depends on their training or their practice policies, etc., their time to see the patient, etc., etc. So you must ask for topical. It's a new and upcoming. I think this area is evolving. So that's what you could buy. I think they come for about 23. So ours is basically Dermacent, but in a larger bottle that you can apply all over the skin to repair. So let's put it this way. Any dog or cat who has defective skin barrier, there's 2 major building blocks that are missing. So I talked about the lipid layer, that's the matrix that's holding the cells together, and that's what's washed away. So it's the ceramides and the essential fatty acids. You replace those, and then you give the skin good food as well, which is what our products do, so that the good bacteria and the good bacteria keeps the back, and same for fungi, keep it in check, and the skin can then regulate and manage itself so long term. So one of our mottos is, we don't want you to buy from us again.
Yeah.
Just buy that one. Yeah.
You will fix the problem, basically.
And it's once weekly, don't apply every day. So this is the other sort of fallacy that we've seen with a lot of products. So we've talked about the perfumes and the chemicals and the human cosmetics venturing into the pet industry. The second issue is some very popular brands using word like vets, something on there, have things like parabens, not just one, but 3 parabens used in their shampoos, used in their tear stain removers. Some of them use bleaching agents. Again, it's a plaster. It's just a plaster.
But you want to make the skin look white so that the owner says, that's worked. Like it removes the tears, right?
It needs to go away immediately. But that's the wrong approach. You need to look at the root cause. Tear stains, there's multiple causes again. Could be, the eyeball issues, breed issues, skull issue. Could be just irritated, eyelashes irritating the eye. Yeah, it could be something as simple as that. But it could be genetic atopic dermatitis, or it could be mites, or human house dust mites. Again, this is another major topic I want to really, really talk about. Our dogs have been domesticated over the years, and they've lost that sense of, in the forest, they would have foraged for botanicals naturally to help themselves, right? And their microbiome would be intact because they're eating from the wild, and their skin's also getting the right microbiome from the soil, etc., etc. Because of the humanization of dogs now, using human-based shampoos, etc., not our fault. This is what we're sold. And they live in our house. We have carpeted houses. We have heating. We have hot weather, cold weather, etc. Their microbiome is obviously getting disrupted. But things like human house dust mites, they're being exposed to. So dogs react and can't shed human house dust mites the way we do. So they tend to accumulate in between the paw, webbing, eyes, ear areas. And that is sometimes one of the major triggers of itching and skin issues.
Interesting.
Highly overlooked. So we have one hair growing out of one follicle. They have multiple clumps of hair growing out of one follicle. So their skin's not designed to shed our human house dust mites. Did you see? So there's the secretions and excretions. They cause even further irritations in the webbing, etc. So that's, if we just take care of that, sometimes if it's a carpeted house, something just to monitor, did they start itching, after they came to your house or something, or did they come with it before or something? It depends. You really need to sort of look at the history.
The question for you, dust mites, are they something that we can, first of all, remove from a house? Or is it something that if a dog has a good skin microbiome, they can fight over this dust mite? So they will live in their skin, basically. And we just need to, we are aware of it because dust mites are everywhere. My assumption is that with the, dirt, that's how they form, essentially. And they're in every single house. We can't see them. They accumulate in their skin. And I am assuming if my dog Rusty is not itching at all, means that his skin microbiome or his DNA is a lot stronger than a dog that is more prone to it.
2 things. He's got a good skin barrier and a good skin microbiome. So the skin barrier. And the other thing is you're probably also just making sure that there's no moisture collection. So there's yeast as well. So we've not talked about that. So human house dust mites. Let's go back to that one. So human house dust mites only become a problem when there's too much and you can't really shed them and they just accumulate and, washing around here or here, whatever it is. So you just need to, you can't get rid of them completely because they feed off our dead skin cells and we're constantly shedding and they tend to collect in carpeted areas. So we can reduce the population by cleaning regularly, which is why you get the advice of make sure you wash your pet's bedding regularly. If they're sitting on your mattress are a hotbed of human house dust mites, just make sure that you're cleaning. So it's the mattresses, the sofas overlooked. So they can pick it up literally from anywhere. So wooden floors are pretty good. If you're vacuuming, you're just, reducing the population generally. So it depends quite a lot on the cleaning. And then just if it's an issue, then just apply, like I would say, just apply the balm. It'll suffocate them and it'll give a good layer on the skin and help the repair, and then it just helps solve the problem. The commensal, they sort of live with us. Dogs have their own mites too, but the mites only become a problem when they overproliferate.
Yes.
And the immune system is down. So sometimes it's just a vicious cycle. Which one's causing what?
Yeah. No, I agree. Completely agree.
Infection comes in and the food becomes an issue because the body is so inflamed. Everything just starts going wrong from there. We don't know about what caused what, but it's all linked.
Yes, that's so interesting. And can I ask another question about the skin microbiome? So I've recently done, and I'm working with a company called Biome for Pets for Rusty for his gut microbiome. They share some really interesting stats about microbiome and things that we're working on. Like we had to do a physical test.
Okay.
Is there a way for an owner to be able to say, okay, my dog has got allergy? Is there a test that can tell you the condition, basically, of your dog's skin microbiome out there?
I don't know about that. I think you're working with a company that's doing that now, checking how good
they do gut. They're specialized in gut microbiome, not skin.
Okay. So usually what you'll find is the gut and the skin are linked. So the gut's imbalanced, the skin's going to, because they're licking the oral microbiome and the gut microbiome and the skin microbiome. If one or the other are upset, then please know the others are also upset.
Yes.
If that makes sense? Because the oral microbiome, if that's wrong and the mouth is smelling, the skin is upset and the gut's upset.
Yes. Yeah, that's
oral
interesting.
microbiome affects the gut. And then vice versa, the gut and the skin, they're all linked.
Yes, interesting. That's really interesting. So I assume then if my dog is itching and things like that, and I'm doing some kind of treatment to restore his gut microbiome, that should also be helping with the skin microbiome and oral microbiome.
Why I talked about these chemicals upsetting the skin. And so when you upset the skin, the licking, it's a gut microbiome as well.
Yeah, it's so interesting.
Are designed to make sure that it not just balances this, but even if they lick it, it's okay.
Yeah.
It's okay for the gut.
Yes. It's just interesting because it's like you assume like, okay, I'm doing a therapy to restore his gut microbiome, but then as an owner, you don't necessarily think, oh, the shampoo I'm using, that could completely ruin the work that I'm doing to restore his gut microbiome at the same time because, they're licking their skin. I'm using products that have ingredients that actually, ruining in a way their skin microbiome. So
yeah, it depends. So shampoos vary. So the other thing about shampoos is apart from the chemicals, they use a lot of gelling agents. So I don't know if you found that it's just so hard to rinse off. It just takes ages to rinse it off. It's not coming off. Why? It's thickened to give you that effect of there's this nice and substantial.
For me.
It sticks to the skin and just takes ages to wash off. And that's the gelling agent. And that not only makes it worse for the whole bathing process, because dogs don't like to be washed that often. I think it's not a pleasant experience. No. It also depends on how often you wash the dogs as well. And I think that's the reason they used to say, don't wash your dog that often. Maybe because they knew the chemicals in the shampoo would strip the skin off.
Yes,
the skin barrier, the lipids of the skin barrier off. That was, I think, the motivation around giving that piece of advice. Don't wash your dog that often. But you do need to wash your dog often, especially if they're out and about, because there's so much, you need to keep a clean coat. If they're, rolling around or outside collecting dead skin cells, all of that. I mean, you need to wash all of that. You do need to keep your dog hygienically clean. So if it's a gentle shampoo, you can wash once a week, a full proper wash, one that doesn't cause shedding or itching. If it's causing itching, so you have people saying, oh, my dog's come back from the groomer and they're really itching. Every time they come back from the groomer, they're itching. It's the products they've used. Sometimes they use products to, it depends on the groomer. Faster, to dry them faster. So all the stuff they're spraying, maybe when you go to your groomer and have a chat about, could you just show me what products you're using? Some of them are also greenwashing. Some groomers take a lot of effort to make sure that the shampoos they're using are from reputable companies, but there's a lot of greenwashing I've seen. So they'll say natural, etc., but only one or two ingredients are natural. Yeah. All the rest are the same.
Yeah. And I agree with you because the outcome is, oh, the dog needs to smell nice after a groom. Like I want to get my dog back as an owner. You think, oh, when I smell like, it smells like, going back to what you said at the beginning, strawberry milkshake, pumpkin, as opposed to, I want back a clean dog with a clean fur.
Yeah.
And, that I know is not going to damage. But you don't think that as a dog owner, unless you're really into that as a person, I think it's not to blame anyone. Like I never thought about that. Like when Rusty comes from a groom, I'm like, you smell amazing. But then you don't necessarily think, and it's like with human products as well. Oh, this shampoo, that smells so good. Yeah. But it's like, what is it that is in there that actually is causing it to smell that good? Because it's not natural for sure, you know?
Yeah, and it's not natural
Think
for
about
them.
that.
Like I
No.
said, we're humanizing them. And
Yes.
so I only realized, like my pet, they have their own, smell, and it's the own dog. It's not a wet dog smell. It's just
No.
a really nice. I know if DJs and, this is DJ's smell.
Yeah.
It's not a fake, it's not a weird infectious upset microbiome smell. It's when you smell
Yeah.
another person, you know that this is there in the room.
Yes.
So maybe call it pheromones, I don't know, but they have their own natural smell. And I really dig into this point a bit more. You have dogs who've been sprayed, etc., and they're walking past by. They need to smell each other. The reason they smell each other is they learn about their age, what they ate, how they're feeling. They can even tell how they're feeling if they're depressed or sad. And that scent is so critical. When you spray a dog and with all these chemicals, you use all these chemicals on them, their smell receptors, olfactory lobe is much larger than ours. Some studies say 100,000 times stronger, the smell receptors or the smell sense, or 1,000,000 times, depends. When we spray them, it sort of overpowers their brain and causes them anxiety, etc. It's just too much, and their own scent identity is sort of then banished. So they're like, I don't know who I smell like, or what am I? Where's my scent identity? We're taking that away from them, and that's the most overlooked form of canine welfare.
Yeah,
so scent
absolutely.
identity protection is so critical. And when they sniff another animal, or another animal passes by, like, you look like a dog, but you don't smell like a dog. It can
Yeah.
cause aggressive issues, because that smell is critical for them to then decide, are you safe? Am I okay to
Yeah.
talk to you? I don't know who you are. You look like one, but you're sending me very confusing signals.
Yes.
So this is something really, really critical as well
Yeah.
that we need to
Yeah.
think about. There's so many layers to this.
They are. Yeah, I completely agree. They are. And I think, and another one you were talking before I forget is the yeast as well. So you said we were talking about the dust mites, and then you said something about moisture and yeast. And that's something very close to my heart, because I see that I will used to see that every single
I
day.
want to talk about this one. Thank you for bringing this up. This is my peeve. So I don't know if you've been noticing, I've been posting so much about ears.
Yes, I have seen it. Love to talk about years.
Ear cleaners, water-based ear cleaners. Why? We have moisture. So the yeast overgrowth in the ears because of moisture, trapped moisture. It shouldn't be there. Then we're using water-based ear cleaners to flush the ear out. We just added more moisture. Yes, that water-based ear cleaner had lots of other chemicals in there to kill the bacteria, the bad bacteria and the bad yeast. And yes, it solved that problem, but you just added more moisture. So the problem will come back with a vengeance. This is, again, another fallacy by the industry. Is maybe, and I'm thinking, is it to keep the person buying? Because this is how markets are built. Get the person to keep them coming back. The welfare of the dog is not key here. We'll solve the problem for you. Yeah, we'll give you, here, take this. We'll put a plaster of it, and it will solve the issue, but it will keep on coming back. And then eventually you'll see the scarring, the inflammation. The dog then eventually loses their hearing. And it's frustrating for the pet parents, because you really want to solve the problem. So yes, so again, you need to do, and it depends on the breed. So some breeds, not just fungi and mites in there. It could be a situation where they are genetically, so King Charles Cavalier, they tend to produce excessive mucus, and you need sort of the dermatologist to then cut through the eardrum to release that mucus and get it out. So that's a serious issue that needs to be looked at. Or it could be mimicking a neurological issue, like, that. So then they need to be then referred to the neurologist. So this is really, really key that the right investigations are done. But the products that we have in the market are wrong. Again, they blast the microbiome. You're adding more moisture. You're causing the problem to come back again. And again, the ear issue, if they're having ear issues, there's definitely skin issues and other allergies that needs to be investigated as well.
Yeah, I have seen that firsthand. We used to have a cockapoo. Every week he had to go to the vet to have his ears flushed. Every single week. I'm not joking. Every single week he had the day allocated to just get, squeeze stuff in. And I had him for a couple of weeks once, and his dad just gave me like this little bottle. And he was like, yeah, you just need to squeeze. And he was going crazy every time I even tried to get close with that bottle.
Imagine.
Crazy, because it was stinging him. So whatever was in there okay, maybe it was a disinfectant, something like that would have worked at that point. But then in 3 days time, the problem will come back.
Exactly what I've just mentioned.
Mm-mm.
They're not designed to
No.
tackle a long-term issue. They're just
Yes.
designed to clean and then to get you back, solve it for a couple of days or a week, and then you come back again. But the damage, every time there's inflammation in the ear, you're damaging that very delicate ear structure, the canal, etc., etc. And the ear is connected to the brain. It's a very delicate area. It
It
shouldn't be
makes them
taken
go crazy. They shake like crazy.
Yeah,
You can
it
see
causes
how
sudden-
uncomfortable they are.
Yes, then it causes ear
Yeah.
hematomas, and that's
Yes.
another issue. So it's not a nice thing to live with, and I'm really very strongly against these water-based ear cleaners with all those
Yeah.
chemicals in there.
So what do you use instead?
We have a balm that's not
Okay.
water-based.
Okay.
It's got products, so it's got ingredients in there that sort of help with the wax buildup. So usually any inflammation in the ear is mainly because microbiome, yeast overgrowth, moisture, the skin in there is not okay. If it's not the other issues I mentioned, genetic,
Yes.
breed specific, or the excess mucus or the neurological. If it's infection, then yes, it needs to be treated. Best to use topical if you can, rather than systemic, to target it. There, it depends whether it's otitis externa or otitis interna. So it needs vet check. So if there's an active infection, please manage that immediately. Then for long-term ear health, you need to be putting something in the ear that kills off those mites, helps the wax to sort of shed properly, and maintains a good microbiome, because the ear will clean itself.
Yes.
If you keep on putting stuff in there that damages it and causes it to everything to come back with a vengeance, you're not really supporting the ear's flora. You're setting up the dog for failure.
Yes.
And you
I
spend
agree with
money
you.
unnecessarily, and you're causing them long-term damage. And
Yes.
they're painfully getting deaf every single time.
Yeah.
This torture is just unimaginable. Somebody needs to say something about this very loudly.
I agree. I completely agree, because all of these dogs I have is like, they are normally the ones that are on steroids every single day. So if you say, why is the problem coming back constantly? Well, because their gut and the skin microbiome is completely messed up, right? So this is why we have to go back to the vet every single week. This is why they have to have their ears flashed every single week. So we're still adding what you said, right? Like water, moisture, and it's just like, at the end of the day, it should be about restoring that microbiome. Make sure you keep the moisture out. You're going for a walk, wash the ears straight away. Normally, it's like the kind of breeds that really love water, right? So they get the ears wet, you get them home, just give them a towel dry, and then they sleep for 3 hours. They have really long ears. So, sleeping like that, and then all of the sudden the moisture is like perfect, to get these bacteria and this yeast just growing back essentially. And then boom, again, they start itching. So it's like that cycle that has to be broken in some way. Because
Yes.
you see, like we're Rusty, we're quite lucky, I think. We never had any allergies or infection. We had the odd, ear infection when he was a puppy, but that's it. And I never clean Rusty's ears. I never do. I have in the last 3 years, and maybe like sometimes maybe, when you're like drying him, but I never ever had to clean his ears, and he's not had any infections for the last
Yes.
3 years. I just make sure I dry him really well after
Just
the
on that
walk.
point, the body has been designed to maintain itself. I think that is critical. If your dog's requiring daily sprays to stop them from itching, or daily or weekly, whatever it is, then there's something not right, that you need to really get to the root cause. And I think this is key here. Find out what the root cause is. And sometimes it's as simple. It could be just something simple. Protect the skin barrier, create a hostile environment for the pathogenic bacteria or fungi to not survive there, and then feed the good bacteria, so they then keep the rest in check, and then everything's managed. Sometimes it could be as simple as that, but there could be, obviously, like I said, other conditions where there's endocrine issues, other issues, cancers, etc., that also need to be investigated. But again, like I said, it's elimination, step by step by step. If it's not this, okay, we've tried, this is fine, this is not improved, then maybe we need to do further investigation.
Yes. Love that. Yeah. Thank you for sharing that. That's brilliant.
Yes, usual common culprits: moisture, yeast, overgrowth, mites, ectoparasites, and they're easily solvable.
Yes, I completely agree. Yeah, I completely agree. And so I'm a dog owner. I always try and put myself into the owner's perspective. I'm a dog owner. I'm at this shop, and I know you have your range, by the way, of products, which, by the way, I will add at the end of episode when it goes live. I'll put a link to your website, because it just sounds like, I've not tried personally your products. It sounds like you found a really good solution. So I'll ask you about that in a minute. If you're a dog owner and you go to a pets at home or to the groomer, and you want to really quickly understand when this, I know most of the products are already little, like they have loads of ingredients that shouldn't be there. But what are they, if we pick up a bottle of shampoo or like a stain remover, what's the first thing on the label that should just straight away bring up a red flag where I'm like, that's not good, I might want to just put that back?
So I think with shampoos, the main one is sodium lauryl sulfate. Like I said,
Okay.
it's extremely effective, but extremely harsh. And you don't want to be using on that delicate skin. Simple as that. So that's number one. But in terms of tear stain removers and other products, watch out for bleaching agents, or like I said, parabens and alcohol. Some of them, a lot of them have alcohol in there. And then the other thing is, I'll just mention this. They use different scientific names to cover up what it is that they're actually including. You know, a lot of pet owners wouldn't know this until they go and do some research. So there are some formaldehyde releasing agents. Formaldehyde is used to preserve sort of bodies, you know, they shouldn't be in our products, but it's a very good preservative, cheap preservative, but it does the job. So it's the shortcut. So they'll call it something else, but they wouldn't say formaldehyde releasing agent.
Yeah.
So it's a bit tricky. But if you see alcohol or parabens or SLS, so anything that shouldn't be in there, then yeah. Or you know what, they can even ask us and we'll direct them to the website and they can check. Not our website, it's a secondary website. You can just check how it's for humans. So this chemical is associated with atopic dermatitis or skin irritation or eye irritation or can cause. So EWG is one good place to check. So Environmental Working Group for Skin Issues, they're a good place because they sort of rank each chemical based on their sort of
research and
absolutely. So that's one area. Then there's PubMed, there's a chemical database. You just put in the chemical name in there and it will tell you warning sign, warning sign, warning sign, do not ingest, can cause atopic dermatitis. I'm like, why is it in the product if it can cause atopic dermatitis?
That's the question I wanted to ask you. How does he get into pet shops? Like, are there not, like, are pet grooming products, we understand they're not held to the same standards as humans, but then I'd say that, and actually, when I look at humans products, so there is an app that I use called Yuka, YUKA.
Okay.
And this app, my dad shared this app with me, like he lives in Italy, and he's like, one day we were at the supermarket and he started scanning everything. I was like, what are you doing? And he was like, oh, this app is amazing. Like you scan the barcode, especially for, you know, cosmetic products or food products. And they have a database of chemicals and additives and things. And it tells you whether, very similar to what you said, but you just scan the barcode, which I wish that existed for pets, food and pets grooming products, but it doesn't. But, you know, what are the standards like for if I want to develop like a pet shampoo with whatever? What are the standards for me to be able to bring that into Pets at Home? Are there any standards, or can anyone bring a grooming products into Pets at Home or any kind of like, you know, pet shops?
The most, I think, with any retail industry, whether it's vet or human, the shops will only stock you if they see it's fast, so they call fast moving products, or if they have some sort of, I don't know how they work actually. It has to be something that's appealing to the human buyers and sells off the shelves quickly. So it depends on the marketing that they've done around it. So if it's a fancy, good looking, I don't know, I'm just speculating. This is how it works. But I know for sure that if there's anything on the shelf, it has to be a fast FMCG product. It needs to move off fast, or I'm not quite sure actually how it works. But sometimes it's not a case of, so I did speak to one company. Sometimes it's not a case of it's a good product and we want it on our shelf for the dogs or the cats or the pets. It's a case of connections. It's a case of, I don't know. I don't want to say anything.
No, yeah, I know what you mean. But it's just heartbreaking, isn't it? Because it's you know, as a dog owner, you just don't think, and not just as a dog owner, but you go to Boots or to any like, you know, place where you can pick up cosmetics, even for humans. Yeah. And when I was used to scan stuff, I was like, wow, how is that
do you get
possible?
in? Yeah, it's the buyers. Sometimes the buyers, they call the buyers, don't have deep knowledge about the industry or why they should be stocking that product. So the buyer will buy on their own certain set of criteria, and I don't know what the industry standards are, because I think that's maybe personal hidden knowledge for the industry. But they need to make sales at the end of the day. It has to be a product that looks appealing and sells itself really, really quickly. And I think a lot of the products that are on the market and are selling are designed, like I said, to appeal to the human buyer.
Yeah. And you have that just goes to show you, you know, you've got to do your research before you buy it, simple as. Because it's the same with like rawhide. I did a video about rawhide the other day. I can still find that in pets at home. Like there is a huge, and it's nothing against pets at home, but it is really dangerous. There are loads of vets that are warning about rawhide. Why is it still entering those shops that are meant to, to provide safe things for animals,
Products, food products, like you said, that shouldn't be sold, but they are being sold. And I think that's the same for human products as well. They shouldn't be on the shelves, but they are, because people are buying them, and they're buying them because they don't know.
Yes.
So it's like they feed into each other. Once the customer awareness is there, they will not buy them. Nobody wants to deliberately hurt their dog or hurt themselves.
No.
So once awareness is there, and I think people will then start to say, okay, this is sort of an economic fallacy. I'm spending £4 or £5, but I'm causing problems worth £1,000.
Yeah,
It's
absolutely. And you don't see that. You don't see that because you just picked up a £5 shampoo bottle that you're like, oh, smells amazing. It says it's natural.
Yes.
It says that it cleans my dog fur beautifully. My dog is going to smell nice for a week after with a perfume, and you just don't know.
And it's caused £1,000 of problems, and it's reduced the quality of life of your dog.
Mm-mm.
And you often see the dogs, because it takes a toll. It's not just physical, it takes a mental and emotional toll on the dog.
Yes.
Imagine living with this itching, constant inflammation in the body. It's not a nice feeling. And then sometimes it causes behavioral issues, and you're wondering, why is the dog aggressive, or suddenly started doing this, and they're barking, or they're not moving much, or the mood has changed, or they're snappy, or something or the other. It's because of this root cause that we haven't addressed, and we're compounding the problem by using these cheap products. And it's not our fault, it's what we're being sold. It's what we can see on the shelf. That's what's there. So this is my choice. I just pick one from here. And I think the industry has, like you said, a role to play in this. You should really offer the spectrum, cheap ones, and everyone should be able to make a choice. And ones that we say you should not buy from us again. It's not a good business model. And I think that's why we're not appealing to many people, because there's not much repeat buys. So this brand was built because I'm a pet parent. I don't want 10 different products in my cupboard, which I did, to do different things. One for the ear, one for the paws, one for this, one for that, one for this. It's crazy. Apply every single day. It's an assault on the dog, and it's too much for my brain. So we wanted to develop a product based on research. So we looked at all the data. There's a lot of research, not mainly in the UK, but other countries, because they do experiments on dogs. It's not ethical here. But they sort of take strips of skin. But there's a lot of research, botanical, etc., from within. So we look globally for the research to see what's being used, how has it helped the dog, etc. What's the research around this? So this is what we use to inform the formulations. That's number one. And number two is we want it to do multiple things at one go and not cause any problems down the line. So, you treat one problem, but that problem causes side effects like steroid. We talked about steroids, and then you had more drugs, and then to manage that symptom, then you had another drug to manage the adverse effect and the side effect of that drug. It becomes just a cascade, and that is ruthless. We don't want to do that. So one product once weekly, and then taper it down to once monthly for maintenance. And you only need an extremely small amount, so it looks quite deceptive. So a lot of companies, like I said, they put gels and they put lots of water to bulk it up. So they use bulking agents. Even the paw balms, you see they put wax, cheap candle wax, beeswax. That belongs in candles, not on your paws, dog's paws. They sweat from here. It's, paw blocking. It's not right. So there's just so many things that don't belong there. So you need something that's absorbed really quickly and helps nourish and repair the skin, provide the oxidants, antioxidants, vitamins, and minerals for it to repair. So they bulk it up. So it looks cheap. It's cheaper for them to make, and they sell it. Package it up nicely, and they sell it. This is a major, major fallacy that I'm calling out. I will not be a favorite. I'm telling you, many, many companies right now, because I'm just calling it out. And I think it's tough for people like me who are actually standing up and saying, hey, that's wrong. You shouldn't be doing that.
But it's beautiful. You've made your mission at the back of it, right? And I think that's it, right? Like you just had to experience and feel that pain with your own dog, and you're like, I'm not taking it anymore, and I just want other people to know about it. That's it, right? That's the
and use
the best part of it.
I said I have all the skills. I know how to do research. I know how to look at papers. I know I'm a pharmacist. I'm from the pharma industry. I know exactly how that works. Actually, by the way, so I said, I'm calling it out. I'm going to do this for the ones who can't speak, the vulnerable ones. And I'm going to raise awareness and create something for fellow pet parents that they can use, keep in their cupboards, and does multiple things once a week and helps the dog as well, works for the dog. If you're having to apply daily, it's not right. Yes. But our products are not meant to replace. So there is place for prescription medication. I have to say that. I'm also from the pharma industry.
Yeah.
It's striking that balance, really. So these products are meant to complement any therapy that the dog's receiving, but also making sure that we're striking a balance there.
Yes, absolutely. So it's one product that then you sell essentially, and that's it, right? So you formulated this based on all the research you have. You've created this one product, and that's what people can buy essentially.
Yeah, so we have a couple. We have skin serums. So we call it a skin serum that you apply on the coat. So people say, how do you apply it? So just literally separate the hair out and apply it onto the skin. And it's, even if you apply it, it's fine. You're applying it, it's okay for your skin. It's extremely good. It's not, so, you have some people say, I wear gloves when I wash my dog because they don't want the chemicals. I mean, that should already trigger warning signs. So I've used a shampoo on my face. I have very delicate skins, just to show that it is so gentle that it should not cause any issues. So it's just sort of, we have shampoo, a no rinse shampoo. We have a rinse off shampoo that washes really fast. So it's already activated foam, you apply it, so wet the coat, apply it, and it washes, job done. And it does, hopefully the idea is the preservatives also that we've used are plant-based. So they're much more expensive, but we can sleep well knowing that even if there is some residue left, it's okay for the dog's coat and skin. We want to preserve the microbiome, even though the digestion is absolutely fine. So plant-based is our core. So things like some shampoos, a majority of them have something called propylene glycol.
Okay.
Propylene glycol shouldn't be in these dog products. They cause atopic dermatitis and skin reactions. So again, what's going on?
Yeah. Why is it added to these products? Why do they add it?
So a lot of these chemicals are needed to stabilize because of water-based or preservatives. So they add quite a few. Some of them are added to maintain the pH, because the pH of the dog's skin also needs to be maintained. That's another thing to check. So the shampoos, then we've got paw balm, very tiny tube. The whole premise of this entire range is that you use extremely tiny amounts. You don't need a whole amount. So it lasts you like months, and once a week. And then 2 serums, one for cats, one for dogs. This one, we say it helps to keep fleas also at bay because of the Pelgornim rosae. So it has multiple effects, calming. So we have a lot of pet parents say, my pet is so much calmer after using this. So they relax. So it has aromatherapy benefits as well, helps with the emotional aspect, but it also helps the skin repair as well. And even if they're delicate, it's absolutely fine. So there's multiple issues. And then what do we have? We have a dental spray that was based off of a very recent study in 2021 or 2022. One was done on dogs, one was on cats. I think I shared that study with you. A lot of these dog oral products, the hypochlorous acid, they use that in swimming pools.
And it's like in like a toothpaste, right? That you can buy online. That's where normally is found, this product.
Ours?
No, the one that you find out there, I mean.
Oh, the hypochlorous acid. So the one they put in the water additive. They put in the water for the dog to drink. So that is like it releases chlorine. So hypochlorous acid is chlorine as soon as it sort of is in contact with bacteria.
Wow.
So yes, the dog's drinking it because they're thirsty. So of course they're extremely thirsty. As soon as it hits the bacteria interact, it's releasing. So when you pass by a swimming pool and you can smell a lot of chlorine sometimes, it's because it's reacting with the bacteria and the fungi in there. Chlorhexidine, again, it's a big no-no. In a lot of these, you can buy it on Amazon. Or it really helped my dog's smell. But what it's just done is obliterated the entire microbiome. And chlorhexidine is also known to cause staining of the skin and the teeth.
Yeah.
Humans as well, there's caution around the use of it. We're not supposed to use it regularly. You're supposed to use it only after, you can't eat after it. So if you give your dog a snack because it's going to cause staining, and then atopic dermatitis. So skin reactions, severe skin reactions found in skin products and oral products. Again, because it's sold so easily on the market, over the counter, people will use it every time this mouth smells. Spray. Yeah, and it's found in toothpaste. So enzymes are good. They do the job. I think brushing is quite critical. So sorry. So that was...
Yeah, I agree with you. Yeah, that is the basic, isn't it? I'll never use these like water additives. I'm like, it's like for us, they just need to have their teeth brushed after food. It's as if, okay, some dogs don't like it. You just need to, socialize them to it. And I know it's hard work because even sometimes I'm like, after food, I'm like busy doing something else. No, it needs to be prioritized because, otherwise you're just going to have problems longer term. And actually, all the shortcuts that people are finding, which I did as well as a dog owner, like Dentastix. That's so close to my heart.
Okay, that one's a wrong. So you shouldn't be in the
Of
market.
course. And I mean, there is like, okay, yeah, there is the science. It's whatever, scrapes
No,
the tires.
there's no
But
science.
like 50 calories for one little thing that is got zero nutrition in there. When actually, what is that doing to the
There's
tooth?
no logic
Nothing.
behind it, and I don't
No.
know it's been marketed. It's all marketing.
Yes. And the studies done, they were done by the big guys, by the way, because I've read them. And I'm sorry to say that, but the reality is it's once this, like what you said, right? Every study is kind of biased in some
Yes.
way or another at the beginning of the call, right? It's so true. But the reality of it is that you've got to educate dog owners to kind of understand that, okay? Because you developed your product, you really believe in it, you share your mission, you share why you're doing it, and fine, okay. But then it's like you need to understand both sides of things, right? Okay, it's been sponsored by that company. What is it that was like you have to learn to read it and really to try and understand it. And at the end of the day, there is you've got to you have to go through that process. You have to listen to different perspective and learn about it. There isn't that study's been done and so that's the truth, because science doesn't work that way. Things change all the time, things are biased every day, and so you have to kind of like learn the different perspective. And then I say dog owners are very intelligent people, right? Like everyone is like, oh yeah, no, as a human you just need to learn to understand it, and then at the back of it, with your knowledge, you make your own decisions for your own
I
dog.
think the majority of it comes from just our historical behavior. We've always been taught to trust the higher authorities and the clinical sources that we've been given. If X is this and they know this is their field, then we will follow them, because it's that trust we place in them. And I think this is also very key. It depends, because we're all humans at the end of the day. It depends on how much, like you said, research is changing. Are we keeping up to date? What kind of worldview and lens do we have? Are we being influenced by X, Y, or Z? Are we promoting this particular product because of, again, X, Y, and Z, and not to mention it? And I think today's dog parents are asking a few more questions. Why? What are the options? And I always advocate for this, even for humans coming into practice. I say, what are your options? Give the full history. What is a follow-up from this? What about the long-term management? What if my dog or cat reacts this way? Can I have a second opinion? Very, very important. Because, sometimes you do see posts about my dog went in with this and they were given steroids, but there was no cytology done at all, for example. It could be something, I don't know where they've been, but it could be, a case of, try this, we'll suppress the steroids. Maybe there's locums or whatever it is, and it happens in human industry as well. I'm not blaming anybody, but like you said, just be well informed to say, this is what should be done if there's this situation. Have that open conversation with your vet. What other options do I have? How would you normally eliminate other differential diagnosis? Could you please guide me on this one? And they will tell you, because they've been trained. And I think just making sure you have that open dialogue is so critical.
Yeah. Ask questions. I always say, like, just don't accept the first option, because, everyone has done different studies. Everyone went to a different university. Everyone had the different life experiences within their field. And so, well, I go to this vet, tells me that, and then I go to another vet, tells me something else. I had that with Rusty, had the reverse reaction of kennel cough nasal vaccination. I went to 5 different vets.
Yeah.
And towards the end, 8 months later, one vet gave me the thing that fixed the issue, and was an antibiotic, but he had to go through a general anesthetic, and it's a soft palate, and it's this and it's that, and it's just like everyone will have different life experiences and different studies, and this is why it's our job to advocate for the dogs and ask as many questions we want to, because we're paying for that service, until we're convinced and happy that the answers are the right thing to do for our own dog.
That is key. You've just mentioned something so important. You are your pet's best advocate, and you know your pet the best. So if you have a gut feeling that this is not right, there's more to this, and you're not happy with the response, like you said, try a different vet, try speaking to someone else, do some more research, but always follow your gut instinct, because your pet will change as soon as they go into the vet's practice. So the vet may not have full understanding of what's actually going on with the pet. It depends on you to convey that message. So I think as humans, we have a huge responsibility. And I think the other thing is, like you said, we're fallible. Depends on our experience, our mood for the day, how fast the clinic's being rushed, etc., etc.
Yeah.
So
if it's like you're 20 minutes behind your previous appointment and you're like, okay, I'm gonna rush this, or like, or involuntarily I might be,
Yeah.
I rushed it and actually I'm not done. Yeah, and that happens. It happens. We're all humans, right? And this is why, again, is wow, I'm paying for the service. Like you said, there is no one else that knows your pet better than you. This is what I was saying, I was, because I'm about to launch DAFY community. And I was like, why am I doing this? Because you have different people. You have vets that are very good at, kind of like reactive, your dog is sick, I'm going to help them. So diseases, they can help you straight away. They know what they're doing. Then you have nutritionists that they are, experts normally in prevention. So how can we feed that dog to make sure they have a long, happy, and healthy life? Then you have behaviorists, they're expert in behavior. And so you've got two, and then you have you, and you are the person who knows your dog better than anyone else.
Yes.
And so you are responsible to then, get all of these people's perspective. You need to be involved, but this is the thing. It's about having access to different opinion, access to different people, after access to all these different things that then, eventually will
Yes.
give you the answer.
Multidisciplinary approach. So
Yes.
physical for joint pain as well. So very, very critical. I think that's another thing. Oh yeah, and on that, so one more product, joint issues. So I noticed there's so many dogs suffering, and the pain management toolkit. So we've created sort of a deep heat type of rub for dogs. So with the Boswellia, so frankincense, Boswellia, arnica, and the various sort of botanicals that help sort of reach the targeted area, release of the tension in the fascia. So nobody addresses this. The pills and chews, joint chews, they work for a couple of months, but then they taper off. Why? Because the pain is not just in the joints, and they're not painkillers. And I think this is a big misconception. People think I gave my dog chews, therefore the pain is gone. Oh, it doesn't work like that. They're not painkillers. And they also burden the liver and the kidneys because you're chewing 1,460 chews, if you're having 1 or 2 every day, or 4, depending on the size. If they're going through the liver and kidney, you're already an elderly dog, they're already compromised, so you're compromising them even more. And I'm suspecting you're on polypharmacy, on all these other drugs to manage the pain as well. So I think this is something that's, again, really, really overlooked. And now there's wars right now. I call it the chew wars. So one vet formulated is chew saying hyaluronic acid, shortane, this is the best one. Glucosamine and chondroitin is now old school. Put that away. Green lip muscle, etc., etc. So there's one is saying collagen is better. Take this one. So it's so confusing for the pet parents, and I think it's very important to highlight this is just one part of the picture, the pain picture. There's the fascia and the muscles that hold and the joint together. Those are so severely spasmed and contracted that they're holding silent pain that needs to be addressed. And that, okay, we have hydrotherapy, yes, but that's again, those muscles are very tense. So there is a whole science around these massage therapy and topical applications of botanicals that help penetrate the area and release that fascial tension and the muscle tension. You'll find your dog moving so much better. So yes, there's place for chews. Yes, there's place for pills. Yes, there's place but you do need to get that, release that other tension that's holding your dog. The muscles start wasting. And I think this is so key. So, when one area is hurting, we don't use it much. And imagine if the dog's doing that day in, day out. My dog's sleeping so much. Oh, he's old. No, he's in pain. That's why he's not moving, because it's too much pain and effort to get up. It's affecting his mental, it's causing mental health and emotional, physical trauma as well. Muscles start wasting away because he's not using them. Then they're not holding the joint properly. So the joints now are more unstable. It's a vicious cycle. So I think it's, again, raising awareness with everybody in the field to say, if you're prescribing pills, give them something for, to maintain and manage those muscles, to stop the muscle wastage. And also the botanicals, like I said, very important for managing the mood changes and the emotional trauma that's happening from the pain. It's critical. The meds and pill chews don't do that. So this is where we come in. We're sort of, it's integrative. We're using science as well to inform our research. We're not just putting any botanical in there. We're also looking at the allopathic and the complementary side of it as well, to see how do we balance it. Because prior to domestication, what domestication took away, zoopharmacognosy is what we're trying to bring back into. Because again, my pharmaceutical background,
Yes,
and public health background, and because they live with us. So whatever products we're using on them, we're also absorbing.
yes.
Environment absorbing.
That is another
That's a public health angle. So it has to be safe. You've got little babies and children in the house. You don't want to be using chlorhexidine and all these chemicals on a constant basis. So I think that's quite critical.
Yeah, I think it's the overall, isn't it? You have to look at the overall picture. Even like chemicals, like that you used to wash your clothes, everything, what you used to wash the floor. It's about changing your mindset around it. And no one is perfect. by no means, and I've got so much knowledge. I'm not perfect. I still every now and then I need to buy stuff. But it's like the more you reduce, the better. And like the more you're conscious about it, the better. The more you like that field is being sprayed because it's spraying time. Okay, let's go and wash that hose properly because it's just been running around there. And it's just about like the little small choices that you make that in the long term are going to help your
And I
dog
think
and not just your dog, yourself as well.
antimicrobial resistance is a major problem.
Yeah.
Because
Yes.
a lot of dog products have like very strong antimicrobials and antifungals, like for the ear or whatever it is. And the more we use them to manage the problem, the more resistance you're creating. So you've just created a superbug. The dog's living in your house. You're also then now susceptible to that. So I think this public health approach is so critical, and it really needs to be looked at as well. And this is the approach that we use. It has to be safe for you. If it's not safe for you, it's not safe for your dog, or vice versa. Do not use it. Be aware of the chemicals. Just be aware that the chemicals being used in the grooming products these days are actually based on human cosmetic regulations and not designed for pet skin, which is completely different. It's a major issue. And skin. So if your dog has issues with itching, flaking, or even cat over grooming, whatever it is, they have a defective skin barrier. You have to do something about that. Meds and pills, yes, you do have to reduce inflammation, but really address that skin barrier defect immediately. I think that's critical thing that I'll send. Even with the ears, water-based. I can't get over it. Water-based ear cleaners, just can't get over it.
No, but I completely get it. And I think once you have the knowledge around it, then you just wanna, just you're dying to just tell everybody about it and make everyone aware of it and try to, not let other people make not the same mistakes, but it's like, kind of like, because you have that background, but other people might not, right?
Yeah,
and it's like
feedback from pet parents, because a lot of pet parents who buy from us are the ones who've tried everything.
Yes.
And the feedback is like, this is the only products that actually work on my dog. And for the first time, I've seen them stop itching. Or they've stopped itching. The paw to really help them. Or they're extremely calm. And this is what keeps us going. We're not really smart when it comes to business. I'll be very honest with you. And I think that's why we don't appeal to investors, because we're not designed to like subscription or repeat buys. We've built this as a fellow pet parent for fellow pet parents. And it's something using clinical backgrounds. It's not just random products. They've been designed for the welfare of the pet. And I think this is where we come from.
Yeah, absolutely.
Whereas I think companies are built.
Yes, of course. So I think a lot of pet parents might, after today's conversation, I think a lot of pet parents might want to maybe have a chat with you, maybe want to get in touch with you. So if someone is listening to this episode and wants to reach out to you, maybe ask you a question, or hear a little bit more about what you're working on, what's the best way for them to reach out to you?
I think just go on the website. There is a message function or contact us page, and just drop us a message. And it's free. It's we're not going to push products. That's not our aim. We will ask you lots of questions about if you have a condition, like what's your dog on, what's their history, what have they tried so far. We'll ask you lots and lots of questions, and we will not, if we don't know, we won't be able to advise you. We'll guide you. We'll say you need expert help. No, we don't push products. We'll recommend another brand, another product, because like we said, we don't have the full range. Ours is just focused on the skin, maybe joint as well. That's it. Ours, that's
amazing.
maybe we
I
recommend
will put in the show notes all the links to how to get in touch with you anyway. So I would do that when I publish the episode. Yeah. Poonum, thank you so much. I absolutely love chatting to you. I knew I was going to learn a lot, but I didn't expect to learn so much. So thank you for sharing your knowledge. Thank you to the audience for watching, and we will see you on the next episode.
Thank you for watching. If you found this episode helpful, follow us on Instagram. And if you want first access to DAFY, join our waitlist now. The links are in the show notes.